In the 1920s, most other industrial nations developed nationalized healthcare for their citizens, except, of course, the US. People seem to think this is some new commie plot, but universal healthcare has been the subject of debate in America for over 100 years. Experts and historians believe there are a few reasons that contributed to America's failure to implement universal healthcare like everybody else. One is that the American Medical Association came out in opposition to universal healthcare because they saw that in workers' comp cases, the insurance companies began picking their own doctors so they could mandate where the employee went for care, thus controlling and limiting the amounts they had to pay out. Doctors knew this would just become a fight to the bottom, effectively strangling their ability to set their own prices going forward. The second thing is that sickness funds were a powerful lobbying force on their own and didn't want to be replaced by free national healthcare. They covered around 35 to 40% of workers at the time. The third obstacle was that the commercial insurance industry didn't want a government plan to become available, which is the same problem we face today. Also in the 1920s, medical tech exploded. Lots of conditions were researched thoroughly and became treatable. We began developing cures that fought diseases themselves instead of injuring the body for the chance to also maybe injure the underlying pathology. At this point, doctors also cemented their licensure requirements, and they created standards for medical students and degree attainment, and hospitals began receiving accreditation too. And overall, the medical sphere became more influential and more prestigious. At the same time, though, costs began to rise significantly for the average family as a result.